to Coronavirus The Rundown. I'm Dan Grossman. Each day we highlight the ways communities are taking on coronavirus. We also break down the major headlines. Today, Memorial Day brings a new warning. Health experts and leaders are renewing warnings about the virus. A number of states saw large crowds gathering for the Memorial Day weekend. And this year, the way we honored our nation's fallen heroes coming with a different look and feel. Only family members were allowed to visit graves at Arlington's National Cemetery.
It was a matter of how can we still honor these fallen men and women while at the same time protecting our visitors and folks that might want to come out.
Monday's annual observance as well as the annual wreath laying were streamed online. Laid-off workers who lost health insurance are facing the first deadlines to apply for fallback coverage. The 60-day special enrollment period ends next week for those who lost coverage at the end of March. But insurance officials and researchers say few people know how to find it. The CDC is constantly working to put out new safety guidelines as it learns more about COVID-19. But sometimes that guidance can differ from what city and state officials are telling us. Recently, the White House released a reopening plan that incorporated some CDC suggestions, but still left many decisions to states and cities. Public health experts say ultimately it's up to us as individuals to make smart decisions about whether to go out to certain places and how to do so.
Be wary of your environment. No matter what's going on at the state and local level in terms of reopening, you still have that personal sense of protecting yourself, protecting your loved ones, and protecting others from you in case you happen to be harboring the virus.
Some places are reopening much faster than others. The CDC says this is okay as long as it reflects the number of coronavirus cases in that area. Public health experts agree that people should be listening to what local officials are saying, but still keep in mind what we know about transmission. The 6-foot distance rule should still be followed no matter where you go. Health experts say outdoor areas tend to be relatively safer than indoors. If you are going somewhere indoors, you should stay away if it's too crowded, traffic isn't being directed, or if people are not wearing face masks. And a little more than half of all restaurants in the country are open right now. It's been tough for these businesses to stay afloat, but as Alicia Nieves shows us, there's one ingredient that's bringing in some big revenue.
The restaurant industry has been one of the hardest hit in the last 2 months.
The numbers that have come in so far about restaurant closures and restaurant job loss have been nothing short of staggering.
The National Restaurant Association reports the industry has lost around 8 million jobs. Since the pandemic began, that's 3 times more job loss than any other industry. And in revenue, total losses stand at about $80 billion, with projections that could go up to $240 billion.
It's been painful trying to manage this business.
Ryan Fletter is the owner of Barolo Grill in Denver.
We are easily down 50%, and I feel like we are enormously successful for being down only 50%. I have 2 restaurants, and the other one is suffering a 90% loss.
Like the 60% of restaurants around the country that are open, Barolo Grill has been surviving on takeout orders for food, and at the end of March, it was allowed to start selling to-go cocktails.
Do a cup and a half.
Selling liquor to go has now become a critical source of revenue.
Everything is a lifeline right now, and we are on a ventilator virtually, so to speak, and life support. You take that away, you'd just be like standing on top of our head while we're underwater.
Almost every state around the country has now begun allowing restaurants and bars to sell to-go cocktails and other liquor.
That actually has been a huge revenue generator.
The National Restaurant Association says it has become a lifeline for the entire industry, but it's not enough.
Some states are talking about 25% of tables can only be served. That's where you actually really start losing money because you're not going to bring in enough customers to make it worthwhile. So we're really at our most dangerous point right now. It's why we need a federal solution from Congress if restaurants are going to survive into the fall.
The Restaurant Association has proposed stimulus package ideas for restaurants that include tax breaks and grant money, but there has been little talk in Congress about it actually being a part of the next stimulus package. So for now, restaurants are relying on what has always kept them alive: their customers.
I hope that everyone will continue to reach out to their local restaurants and participate in whatever program they're doing, whether it's food, beverages, or both. it's part of why we're alive.
I'm Alicia Nieves reporting.
Some small and large businesses alike have been forced to close due to the pandemic. That includes car rental companies like Hertz. It declared bankruptcy on Friday, and now the company is expected to sell a large portion of its fleet. That means these cars will likely come with deep discounts. Not everybody is in the market to buy a car right now, but if you do decide to check out these deals, experts say shoppers need to do research. Your bank or credit union may give you a better financing option than the rental companies. The FDA is beginning to crack down on antibody tests. More than 24 test makers have failed to file applications so that they can keep their tests on the market. Some makers have already pulled their products. In order for these tests to continue to be used, makers must prove to the FDA that they work. The FDA has not yet said if these companies will face additional penalties if they don't do so. More people are wearing masks right now, and it can make it tough to see facial expressions. Chris Conti shows us how one group has found a see-through solution that might benefit all of us.
As we shield ourselves from the virus, we've lost something. A smile, a glance, a reassuring gesture, covered and hidden by a mask.
You look at people's faces because a person's face tells you so much, and it conveys so much.
As an interpreter for Brigham and Women's Hospital in Boston, the inability to use facial expressions for James Wiggins has been particularly challenging, especially for COVID-19 patients who are deaf.
They could still see me signing and using my hands, but a lot of the message would be missed.
In addition to sign language, many hard of hearing patients rely on lip reading to communicate. Traditional masks make that nearly impossible. But James and his colleagues have found a clear solution.
If I had a mask like this one, then, as you can see my lips.
It may not seem like much, but that transparent piece of plastic is a game changer. Suddenly, James's mouth is accessible again. Patients who rely on lip reading to communicate can see what James is saying.
So having this clear shield, this enables them to be able to see my lips.
That it really has removed barriers for these patients.
Niv Patterson and Dr. Sherry Blowett both work at the hospital and have seen the impact these transparent masks have had.
For our patients now to be able to lip read, to be able to see our emotions come through the mask, especially where we're in a time where we have to social distance, it means everything to them.
Doctors across this hospital and others have also noticed these masks and are asking for them. James believes it's because they're offering patients the chance to see doctors and nurses smile.
When someone smiles, it puts you at ease and it puts your defenses down.
While there may be no cure for COVID-19, these masks are at least helping to ease some of its side effects. In Boston, I'm Chris Conti reporting.
Tens of thousands of dollars invested into technology that will keep employees safe.
It's a huge effort.
A look at the big precautions some companies are taking and why some experts say the technology can only help so much.
CERF.org.
Companies know getting their employees back to work is key to surviving, staying competitive, and keeping staff employed. Maya Rodriguez looks at how new technology aims to make it safer to be at work and what we can all expect if it becomes mainstream.
It looks like something out of science fiction. A portal made up of ultraviolet lights designed to kill an enemy you can't see.
That's kind of the first layer of protection that we've implemented.
Christian Pinkston heads up his own strategic communications firm. 50 employees usually work within this 16,000 square foot office. But at the moment, it's far fewer.
Right now, it's dark and lonely.
So Pinkston decided to turn to new technology to try and create a safer workspace for when his employees return, starting with that portal of UV lights designed to kill any pathogen, including the coronavirus, that may be on any person or thing.
Every guest or staff member will walk through. You do kind of a slow turn.
The technology takes off from there. There are ultraviolet lights in the ceiling at a level safe for humans, but deadly to viruses. And there's titanium dioxide, a compound sprayed on everything here and said to self-disinfect any surface for up to a year. Plus, there's now a real-time air monitoring system installed. Researchers at Columbia University found that specialized UV lights like these could eradicate 2 seasonal types of airborne coronaviruses. But what about the rest of the tech?
There's not enough data yet to know what's safe and what's effective.
Dr. Donald Milton is a professor of occupational health at the University of Maryland.
I am thinking a lot about, what kind of investments make sense to try to protect people in workplaces.
He says it's understandable for people to turn to technology as a coronavirus fix, but the eventual solution, he says, will require more.
It's going to be a combination of figuring out which technologies do work in the workplace, getting good ventilation in workplaces, getting air sanitation, having good cleaning practices.
Back at the office, Pinkston says it's all worth the investment of tens of thousands of dollars.
It's a huge effort.
One that might be required of other workplaces if this all proves to be effective. In Falls Church, Virginia, I'm Maya Rodriguez reporting.
Pinkston conducted an anonymous employee survey recently and found many employees still fear returning. That's despite having that new technology installed. So for now, the company has no set date for when workers there might return. More businesses have added or are considering adding thermal cameras to get the temperature of people coming in. But there may be some limitations to this technology. The FDA said last month it would temporarily allow companies to market thermal cameras that have not been vetted by regulators, but that they should still follow existing recommendations that the devices have an accuracy within 0.9 degrees Fahrenheit. IPVM, an independent site that tests surveillance cameras, says it's found systems that scan the area next to your eye are more accurate.
For places that have smaller shifts, we've actually seen them using systems that scan that area instead of the forehead. But for places that have a high volume of employees or public venues that want to implement this, for example, that's going to be really difficult and just cause bottlenecks as people try to enter the building.
He says for businesses using these cameras, a lot of the marketing doesn't match the actual engineering recommendations from the companies.
What these manufacturers are actually recommending, when you really read into it, is that everyone remain sort of in a stable location for a few minutes after coming in to a building. And that's not really how people are prepared to use these things.
The ACLU warned this week against using thermal cameras, saying they're often inaccurate and intrusive. It says technologies like that give people a false sense of security and may make them less vigilant about wearing masks or social distancing. One thermal camera company tells the Wall Street Journal it realizes these products have limitations, but that they can be helpful in keeping people away from others when they're not healthy. New data is giving scientists a better look at how coronavirus is impacting the environment. Stacey Ann Gooden looks at how much air quality has improved.
You may notice breathing in the fresh air seems a lot easier these days. The sky a lot less hazy. And the proof is in NOAA's latest research project on the pandemic's effect on climate pollution. Shinrong Ring is a senior research scientist at the University of Maryland's Department of Atmospheric and Oceanic Sciences. He, along with his team, have been tracking the change in air quality dating back to this past February. And the results are staggering. Air quality improved 50% at the height of the pandemic compared to the same time last year in the Northeast.
Now we usually get to the airport around 7-8 a.m. and then we get, normally it takes us about 2-3 hours to get everything prepared before takeoff. We have different instruments to measure different concentration of air pollutants like ozone, nitrogen oxide, sulfur dioxide, carbon monoxide, things like that. And we also measure greenhouse gases like carbon dioxide and methane.
Dr. Wren and his team loads 500 pounds of equipment aboard this Cessna before traveling from Maryland to New York City. These canisters connect to piping that's attached to a device outside of the plane. The real-time air samples are collected and sent back to the lab. From there, they create these graphs to compare the relationship between different greenhouse gases to estimate air quality quality. They're also able to compare the pollutants with wind patterns to find out where the pollution is coming from.
Where do you find the most concentration in terms of where the poorest air quality is normally? Is it over a particular borough? Is it collectively regional?
It's mostly regional, in the city area, because it has a lot of people living there, lots of cars, emissions. So so far we found that New York City has the most pollution.
Even though the city rates higher compared to other parts of the Northeast, pollution is still much lower than before, but it won't last long.
Researchers say they can already see the decrease getting smaller as states reopen. People are finding comfort during the pandemic taking care of animals. Ahead, this NICU nurse's story of why she takes care of sick babies at work and sick fur babies at home, and a reason a rescue organization wants your animal stories.
Home experts at theindychannel.com.
We've heard a lot about heroes during the pandemic, but there are some largely unrecognized creatures keeping everyone's spirits up, and they may play an even more important role as we recover. Lindsay Boach has their story.
Policies were changing like this. Every hour I'd get a new email with a new policy. We couldn't keep up. Colleagues are really stressed out about their families.
Diane Foxon is a NICU nurse in Silicon Valley.
Even though we work together right next to each other, saving a baby's life, as soon as that's stable, it's 6 feet apart.
She takes care of sick and premature babies professionally, and when she gets home, it's more of the same. She's a foster mom for Humane Society Silicon Valley. When COVID hit, they were sure Foxon wouldn't have time for specialized sick kitten care.
I didn't have any at the time, and I kept where are my kittens? I need kittens. It's kitten season. Where are my kittens? I need something to de-stress.
She ended up taking on 5.
My cats have been, and I'm sure plenty of my other colleagues, their animals have been their crying post.
And I love the fact that, for someone that you think, oh my gosh, they wouldn't want to take on anything more, for her, it's actually a source of joy.
Carol Novello is the founder of Mutual Rescue, a group that advocates for animal adoption from shelters and rescue groups.
My doctor told me to buy a funeral plot because I would need one within the next 5 years. But I'm still here because a shelter dog saved my life.
Mutual Rescue started telling short stories of how shelter animals helped people with all sorts of difficulties: obesity, suicide, addiction, PTSD.
We can find ourselves stressed out, or we can find ourselves in a place of fear. And one of the things that's so wonderful about a rescue animal is, one, how appreciative they are to have a home.
Now Mutual Rescue is looking for stories like Diane's. Animals helping people cope during the pandemic.
As the folks that are on the true front lines taking care of COVID patients, watching them die, coding them, they're going to need someone or something to talk to when they're finished.
I'm Lindsay Boach reporting.
A birthday to remember. A lot of special events have been canceled during this time, but one dad made sure his daughter had her special day. Why this isn't the end of her celebrations.
Only on RTV6 News.
Welcome back. We like to end with stories that remind us of the good going on. Today, a girl in California is looking back on a memorable birthday. Shay Alexander hasn't been able to see her dad for 2 months due to social distancing, but he still wanted to make her 12th birthday special. So he organized a car parade and brought Disneyland to Shay.
I felt so special. I feel like I'm a queen right now. This is awesome.
Dad still plans on throwing Shay a birthday party once it's safe to gather again, and he's also got another surprise in the works for her. That's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Dan Grossman. Thanks for joining us.